yeah, it's one of the things that really attracted me to the PhD in the first place, because I didn't want to be really removed from industry.
Yeah.
Yeah. And
Yeah.
so actually getting to be in organizations and
Yeah.
that are really engaged in wanting to make change it's such a privilege. And I walk away from these focus groups and interviews just in awe of how much knowledge I've been entrusted with.
That was the voice of Elena Piere, the guest on this episode of The Knowledge Mill. I'm your host, Greg Yoakum. Elena Piere is a PhD candidate within the Food Waste Innovation Team in the Food Science Department at the University of Otago in New Zealand. Elena's research is funded by a research grant from the Ministry for the Environment and centers on developing, trialing, and evaluating the impact of a behavior change intervention toolkit, co-designed with industry stakeholders, to enable practical and lasting change in the aged care sector. Elena has a background in sustainable business. She has worked on food waste and sustainability projects in both academic and industry settings, including conducting waste audits and advising on waste reduction strategies for organizations. Beyond her research, Elena has experience in teaching, research, and governance roles, including serving as a postgraduate representative on the Otago University Net Carbon Zero Governance Board. She is passionate about bridging the gap between research and real-world application, ensuring that sustainability solutions are both evidence-based and actionable. As we walked to the room where we recorded this episode, Elena and I immediately found ourselves headlong into a very interesting chat about aspects of the PhD life that made me wish we already had microphones in our faces. Which is to say, conversation came easy to us. I hope you enjoy it as much as we did. This episode of The Knowledge Mill was recorded on December 3rd, 2024 on the campus of the University of Wollongong during the 37th Conference of the Australian and New Zealand Academy of Management, aka ANZM. Show notes, including links to more information on some of the topics that Elena and I discuss, can be found at theknowledgemill.com/episode 13. That's episode and the numerals 1 and 3. Hi, Elena. Welcome to the program.
Thanks so much.
We are here on day one proper of the ANZM conference, but of course there was the doctoral workshop yesterday. What's your conference experience been like so far?
It's been really good. This is the second conference that I've been to as a PhD student, and my first one internationally, so coming from New Zealand. And it was a really great workshop yesterday. Very full. I was amazed at how much they put on.
Yeah, right.
And so lots of concurrent sessions where you sort of had to pick which you thought would be the best. But yeah, there were two sessions that really made it for me. So one was around being brave in your methodologies. And so challenging us to think beyond just using interviews, focus groups, and surveys.
Right.
And then the other one, we were really lucky to have Mike Jackson, who was one of the keynotes today, but he did a session yesterday as well, looking at action research and systems thinking.
Oh, okay.
Which was really fascinating.
Yeah, and kind of connects back to the other.
Yeah, very much.
Not a lot of action research out there, actually.
No.
I'm all about that as well. I like the creative methods.
Yeah.
Are you thinking about doing something unusual in your study?
I'm looking at using co-design, which is working with your participants to design the research method together. And then, also looking at an intervention study and evaluation of effectiveness. But have also used interviews and focus groups.
I think the more data types you can get, you can better triangulate some real findings. And there's been some calls for working with the subjects of studies to get their input. And I think this is just anecdotal on my part, but I feel like you're going to better understand a case study, for example, which is bounded, of course, if you understand the reality in which that case study operates.
100%.
And if someone's uncomfortable doing a focus group because they don't do that kind of thing, but you can do this other thing like shadowing or something that fits in better with the way they work.
Yeah, absolutely. The interviews and focus groups that I did were at aged care facilities. And I would be at the aged care facility for a couple of days. And so we'd sit down and we'd do these formal interviews. But then I would be in the kitchen with the kitchen staff, and the conversations that happened while I just hung out as they did their work and their processes were really insightful and just built so much more depth than anything that I got out of the interviews.
Yeah, absolutely. Yeah. I used, in my PhD, I used shadowing, and very little of that data went into my thesis, but all of that data added so much color and depth to the interviews, to the observation, because it told me what questions to ask. I noticed that you did this thing. Why did you do it that way? And then they could tell me, whereas I wouldn't have known to ask about that, and they wouldn't have known to tell me because it wouldn't have been interesting to them.
Yeah,
yeah,
absolutely.
Because I didn't have experience in the industry at all, so everything I was seeing was new to me outside of the management, the overarching management aspect of it. Well, that's all. I'm sorry I missed that one because that sounds really interesting. And we were speaking before we started recording about how I just miss being a PhD student and doing these workshops anyway. There's very little of that. I don't think there's much imagination, and I don't mean that in an insulting way. I just mean it in the way of we can do better in terms of, different types of data, meeting people where they live, studying them the way they like to be studied, and including them in that. Even simple things like, I have this quote from you. Am I understanding it properly? Am I taking something out of context? Have you used a phrase idiosyncratic to your team because it's a little in-joke, but it's a normal word to everybody else? And so I've misinterpreted what you said. That leads us to new insights.
Yeah, absolutely.
Yeah. Well, that sounds great. So the first day of the conference was today, and we're here at the end of the day. I know that you just went to a keynote. What have you seen today that's been interesting?
Yeah, so that is an interesting question. This might be slightly controversial, but both of the keynotes were fantastic speakers, but they're both emeritus professors, and both essentially opened with, it's amazing being an emeritus professor because I can now study what I want and I can publish what I want, and it doesn't matter what sort of rating in a journal it is. And what they were proposing in their keynotes was very much able to be done because of where they are.
Right.
But not really able to be done for any current or upcoming academics because the institution and the incentives don't actually support that style of research or that style of approach. So a fascinating conceptual process, but sort of how is that actually applicable without some pretty significant structural change?
Yeah, that's right. And if anything, it's probably going in the other direction where we'll have fewer emeritus people in positions and endowments and those kind of things in the future. I think those are going to go away. So enjoy it while you have it, I guess. Sounds nice. Well, I mean, it's an interesting aspect to academia, isn't it? That there is, everywhere you look, it's privilege and
and layers of it,
and layers of it, And I think it's something I wrangle with actually, and I'd be happy to talk about further if you'd like. But what you can't give your privilege back. No. And so, what can you do except to just make sure you're not pulling up the bridge behind you? Not gatekeeping, in other words.
Yeah, I think that's a big part of it, is sort of the not gatekeeping.
Yeah.
And I think when you are aware of your privilege, then I think that opens up opportunities for you to be more aware of where you can offer mentoring or assistance or whatever it is.
Yeah, that's right.
Whereas if you're not aware of it, then you're much less likely to make that extra I don't know, effort.
Yeah. And that's what it takes. You need allies everywhere. Everywhere needs allies. I've done some training at the uni, allyship training for the LGBTQI plus community, and I've always been an ally, but I do those kind of things because inevitably I learn more things. I learn new things. I learn I get the answers to questions that I didn't know to ask, like we were saying before. And inevitably, those are the kind of, well, take for example, pronouns, which are a very contentious topic in some circles. But pronouns, well, before I did the allyship training, I referred to them as preferred pronouns. And the guy said, well, it's not really, that would be like saying your name is your preferred name. It's like, well, point taken. Their pronouns are just pronouns. But he explained it in a really interesting way, which is like pronouns are not necessarily, this is maybe not the best word for it, but not necessarily important to me. So if I put them in my email signature, for example, it would just be he, him. But he explained that if you put pronouns in, whether or not they're important for you, that signals to other people that you will take their pronouns seriously. And so that creates an inclusive space. And these are the kind of things that I like and that I try to do. And in fact, that's the reason that I, to date, still haven't put pronouns in my email signature, is only just because I still have more learning to do. And so I don't want to send a signal that I'm ready to do things that I may screw up.
Yeah,
I don't want to cause unintentional offense.
Yeah.
So I want to feel like I'm at the point where I can, that when I signal I'm ready to do this, I actually am ready to do it.
Yeah,
and take it seriously.
Yeah. That's a fascinating approach. I do put my pronouns in my email signature for a couple of reasons. One is my eldest is non-binary, and so it sort of has that close to home.
Mm-hmm.
But also, I think the potential, if you wait until you are like, oh, I will not make mistakes, you're never going to not make mistakes.
Yeah,
and
that's
so
right.
Doing it and recognizing that, yeah, you're going to do things wrong, but as long as you are doing it with the best intentions, and a willingness to learn and a willingness to be humble about your mistakes, I think that you get more learning in that process than being like, oh, I'm going to wait until I'm not going to make any mistakes.
I know enough about myself to know that point will never come. So I'm just trying to get to where I'm confident. Yeah. But then, like you say, then I'll still have learning opportunities that come along the way. But I think as long as you're acting in good faith, like you said. I didn't expect to go down that road, but that was very interesting. But I will just move us on to hear a little bit more about you and your work. So how did you find yourself doing a PhD?
Yeah, it's kind of a funny story. I had zero intention of doing a PhD.
Mm-hmm.
So I left high school and went into industry. I was an outdoor educator. Just traveled all over the place working. Met my now husband and had 2 children a little earlier than expected. But when I came out of maternity leave time with my second child, I was really struggling to find work. I didn't want to work in outdoor education anymore. It required too much time away from home. And I wasn't getting any work that I was applying for. And when I would say, oh, can you give me any pointers as to what would have made me more, right for the job, they'd say, oh, we're really sorry, but we gave it to the person who had the degree. And so it just dawned on me that actually I needed to go back and I needed to study. And so then it was very much, what are the transferable skills from what I've been doing to the next thing? And so for me, that was management, because all of my work in industry was around program management and facilitating groups in the outdoors. And so, I started at the University of Otago because I live in Dunedin. And I went into a management degree in commerce. And then it turned out that I'm really good at academics. I did very well. And I was very strongly encouraged to do a master's. So I worked very hard and was able to get a scholarship to cover my master's, which I was very privileged for. And
was that a master's by research or?
No, it was a coursework master's, actually. Yeah. So 2 semesters of classes and then 3 months of research. And then your output, you could choose if you did a research piece or a project. And so the research, you needed a contribution to theory, and a project, it was just doing something more in industry. And yeah, I'd had a project lined up that was, it ended up falling through with the change of government in New Zealand, and sent me into a bit of a spiral of panic of what am I going to do now. And then the head of department sent me through this PhD opportunity, and she said, I know you've said no all year, but this one looks like it could be really interesting to you. And I'd sort of conceptually thought the idea of having a PhD would be cool. But hadn't actually ever talked to anybody who had had a positive experience of doing a PhD. So either it had taken them crazy a long time, or they'd had a hellish experience with supervisors, or just so many different things. I hadn't had any conversation with somebody who was like, yeah, I really enjoyed my PhD. So I was quite scared about taking it on. But it was a funded project, a full scholarship. It was working directly with industry. Just had all of these things that if I was going to do it, this was going to be the things that needed to happen. It was ticking all those boxes. And so I thought, I can't not apply.
Making it harder and harder to say no.
Exactly. And so I did apply, and it worked out really well because they had got the funding for the project in June, and I was applying in October. So they wanted somebody to start straight away, and I obviously needed to finish my master's first. And I was like, yeah, I'm also trying to figure out a research project. And so what I ended up doing was the literature review. I did a systematic literature review of food waste and aged care as my master's thesis. But it fulfilled the component of research, of a literature review for the funder. So it's sort of a win-win and got me into the project.
That's fantastic.
Yeah.
Take those where you can get them.
Absolutely. Yeah. So yeah, I stumbled into it is the honest answer. That's how I ended up here. So yeah, I officially started in May, and December now. So yeah, very early on in the journey.
But you have a bit of a head start in a sense because you've done some of the lit already. And
yes, so I have an understanding of the research area that I'm going to be working in. And that literature review has carried me through the first months. But obviously, I will be doing my own literature review for the PhD.
Yeah, that's right. But at least you're not coming in cold. That's because it's so easy to get lost. You come in from nothing into just all these ideas and existing research and paradigms and theories, and it's a lot. It's one can get lost. Having a structured project already does help, I think, with that keeping on track, stopping you from going down too many wormholes. And before we started recording, you told me that you do have kind of an unconventional setup for that you do have a structured approach. Can you tell us a bit about that?
So the project is funded by the Ministry for the Environment, which is part of the New Zealand government. And it's part of a suite of projects that are looking at behavior change interventions to reduce food waste in various different contexts. And so our context is specifically looking at aged residential care, and the levels of care where all of the food is provided by the aged care organization. So excluding independent living, for example. And so it's a 3-year project for MFE, and the desired outcome is that there's going to be a 10% reduction in food waste in aged care. And the mechanism of change is a behavior change intervention that is then it's designed, applied, and the effectiveness of it is tested, and then an output that can then be shared with the wider industry.
Okay. So something that can be scaled, is that the...
Yeah. And so that's the project from the funder. And then the PhD sort of sits behind that. And so...
Lurking.
Yeah. And so I've chatted actually at the conference to a couple other PhD students who are similar in the sense that they're working on part of a project, but the project is much bigger. So they're working on just one piece of this wider project, and there's other researchers and industry professionals also working on it. So they're working on this one little piece. And I think what I'm working on is a little bit different in that I'm the only one doing the work on it. I have the supervisor team, obviously, as well. But yeah, the person who's doing it is me.
Yeah.
So it is not necessarily a wider project. It is the project. Yeah.
Wow.
Yeah.
And it's full on without the PhD to do something like that.
Yeah. So I'm definitely at a point of a bit of overwhelm, but and just trying to navigate how there's a bit of a tension between what is project and what is PhD, and how do I ensure that I can get a PhD out of it at the end and stick to time frame. As I said, I'm on a scholarship, and I'm pretty committed to finishing while I'm on that scholarship and not paying for this PhD myself.
Yeah, that's right. That's you. Once you get to that, the more that it drags out, and if you do have to start paying your own way, the chances of finishing just go down and down and down, just statistically speaking.
Yes.
Do everything you can to avoid getting yourself into that situation for sure.
Yes.
Well, that's interesting, because the thing that I've maybe said in every episode of this podcast I've recorded is that the best advice I ever got in my PhD effort was to only do one PhD, because it's easy to want to do 3 or 4 or 5, and certainly you have the ideas for that many. And I think I did like 1.5, so I felt like that was pretty good. But because if you have the project, and it is what it is, and it's fixed, and you have to have these deliverables in terms of a scalable model and best practice, or whatever form that ends up taking, that has to be, you can't whittle that down.
Yeah.
Whereas a PhD, you can always just focus tighter and drill deeper and bring it in and bring it in and bring it in, but the project is the project.
Yeah.
Yeah.
And so it's just going to be, I think, a process of sitting down. I have quite a large supervisor team. So the other, we'll say, complexity is, so like I said, it came through management. But this project sits in food science. So I've shifted departments. But the supervisor team sits across food science, human nutrition, and also management. And the management part was my request. So I know we're going to get to future plans in a bit, but
you can tease us a little.
I'll tease you. If I wanted to go into academics, I would want to sit within the management space. And so I knew it was a bit of a risk going into a different department and stepping away from management and having a body of work that wasn't necessarily really closely aligned with management. And so my solution to that was to bring in a management supervisor, so that I had a supervisor on that support team who could really ensure that there was that management thread running through it, and that guidance towards where we're going to publish, where the work can sit, making sure that I'm getting those theoretical critiques and contributions that are approached differently in other departments. But the result is that I have 4 supervisors, which they're all incredible women, and I'm so grateful for the support that I get from them. But the logistics of having a 4-person supervisor team is it's a lot. I didn't realize the amount of people management that would be involved.
And the catch with brilliant supervisors is they find themselves busy.
Yes, absolutely.
Trying to get them all in one place at one time is tricky, even if it's a virtual place. We
do have a standing 3-week 9 a.m. Monday meeting.
Oh, good.
Which is good, but yeah.
Yeah, it's and that keeps you moving too, because you've got
absolutely.
Yeah.
And
I think those kind of things are important.
Absolutely.
I used to catch up with there were 2 guys. We were doing our PhDs together at UTS, and we had accountability meetings each week. We caught up for coffee, and The first 10 or 15 minutes was, okay, you said last week you were going to complete this chapter. How you going with that? And just keeping each other honest. And then it just devolved into whatever I did. Actually, you asked me before, and I didn't really finish answering about how I got into podcasting. Those kind of things were actually what inspired me to do this, because inevitably those conversations take interesting twisting turns, and it didn't go into any of our theses or any of the articles that we wrote or anything like that. And I just thought, not because we were so brilliant that I just thought like someone must put microphones in our faces, but more just like there is so much. I have a feeling all the stuff that we've talked about so far recording this interview, very little of it, if any, will go into your thesis.
Oh yeah.
And so these are the kind of but they're the ideas that you're swimming in right now.
Absolutely.
It would be a shame to not have a microphone in your face. We were actually having such a good conversation before we started recording that I was like, I've got to remember to talk about all these things because this is good. This is a good chat. But yeah, so that's fantastic, and it sounds like you're set up for success then, because I think the more feedback you can get is great. If you got the people from different fields, we are at a management conference, so you're staying true to that with your conference attendance as well, because you're right. It's all of these fields, and I think it's only getting worse in some places. I'm not sure about Otago, but some unis, the with looming financial stresses and things like that, they're just doubling it down in their own silos, and they're really not crossing over, because I think the fear is if you prove that you can cross over, why not just be one faculty?
Yeah,
and we'll eliminate half your jobs. And so, you know, people reacting to reality. But so you're thinking about things like an academic. You're thinking about them the right way. I think, from where I'm sitting, you're thinking about it the right way.
Yeah, it's an interesting space. At Otago, the food science and human nutrition work closely together. That's pretty well established. There's a lot of crossover and similarities in that work. But yeah, the management addition is definitely a stretch. Yeah, but it's been really cool because there's not been any opposition to my saying, hey, I want to take a real organizational lens to this. They're very much on board, but it's an interesting process, because I don't think if it had been somebody else who had stepped into it who had a really strong human nutrition or food science background, I think it would have evolved into a very different project. Right. Yeah.
Or you would have some stronger debates in those meetings, and no, we're not doing it that way. We're doing it this way. And yeah, that's everyone gets to the point, and you'll get here too, where you know more about your project than your supervisors, because you become the expert. That's the whole idea. And so it is interesting that you'll have your feet in both of these, on both sides of the fence, as it were. But then you'll have become expert in that amalgamation of the two. I think that's a pretty cool place to be.
Yeah, it's wild, that whole expert piece. So reducing food waste in aged care is a very hot topic at the minute in Aotearoa, New Zealand. There is huge industry interest in this. The project itself is testament to that. It's been this really amazing collaborative space in this pre-competitive space, which has been so cool to be a part of, and sort of helping perpetuate that. But I've had the privilege of being invited to speak at 2 different industry conferences in the last couple months, and it's amazing just how engaged the industry is, but it's also absolutely terrifying that they prop me up there and go, so the expert in the field, like, I've literally been doing this for 6 months. I don't think you can call me an expert yet. But it's coming to the quick reality of that I've spent more time looking at it than any of these other people have.
Yeah. You have the luxury of time and the resources, and
yeah, I think it's the beauty of this project as well. The need to reduce food waste was identified by one of the aged care organizations. So there was a pilot study that was done through Food Waste Innovation research team at Otago before I came on board. That the aged care organization came and said, hey, we want to do this research. Do you have somebody who's keen to be on board? And then that was really the seed that created the larger project. And so it's very much been driven by an industry desire saying, we have this problem. We're wanting to make our systems, our organizations, and our healthcare more sustainable. Food waste is something that we can do something about. Like, let's do it. And so, it's one of the things that really attracted me to the PhD in the first place, because I didn't want to be really removed from industry.
Yeah.
And so actually getting to be in organizations and that are really engaged in wanting to make change it's such a privilege. And I walk away from these focus groups and interviews just in awe of how much knowledge I've been entrusted with. Yeah, that's right. And what a legacy it'll be too when you're done with it, to be able to point at it, and because like you said before, it's your project, and you could say, I did that. I made this change. You can measure it quantifiably. You can even qualify it in different ways. That's so cool. Yeah. And how exciting as well. Are these organizations, these healthcare organizations, are they public organizations or some private? That's a great question.
I'm only asking because I was curious if the government imperative was coming because these are public organizations, or if it's private industry pushing for it.
So don't quote me on this. I think they're all private.
Mm-hmm.
It's a mix of main group organizations that have multiple facilities across the country, as well as some independently owned facilities. And then we actually have one iwi-owned facility. So for those unfamiliar, Maori are the indigenous people of New Zealand, and their tribal structure, they are in different iwi. And so it's an iwi-owned corporation.
Okay.
Yeah, and so we have a mix. I have 14 different facilities in my study.
Yeah, right. And that's because they would all maybe have different missions, different visions. They're doing basically the same thing, but maybe there are competing demands.
They are all offering the same fundamental service, but there's definitely significant differences in the way that the organizations are structured and their specific missions and their strategies and their values. And so we've got variation across like urban and rural facilities, as across both the North and the South Island. We really wanted a range, and there's also variation in where they are on their sustainability journey. So there's some organizations that have actually done quite a lot and are very aware, and there's others who this is the first time they've thought about it. But like I said earlier, the engagement is high. There's the desire to make a change.
Are you able to speak to where this food waste is coming from?
Yeah, so we did an initial food waste audit across all of our 14 sites. And so that involved measuring all of the food waste across 3 days over a given week. These were non-consecutive and had to include a weekend. And we're actually really lucky. We've been able to use some technology. They're method and site bins, and they've got these smart scales so standardly food waste audits are really labor intensive, but because of this tech, all they have to do is put the food waste in the bin, and then it sends that information to my computer.
Oh, that's really cool.
Yeah, it's really cool. So there's been a few limitations. They need high cell service to work, and it turns out that there are a lot of commercial kitchens that don't have cell service. So there's been some hiccups, but anyways, basically what we did was we measured food waste by source. So we are looking at preparation waste, serving waste, and plate waste. And so preparation waste is any waste that has come from the process of preparing food. Serving waste is food that has been prepared for service that has not been plated, and then plate waste is anything that went out on a plate and then wasn't eaten. And so what we found was that plate waste was the largest source of food waste across our sites. making up 59%.
Wow.
Yeah. And then serving waste was next, and I can't remember the number exactly, but it was the low 20s. And then preparation, I think, was maybe 18%.
Right.
Yeah. And so it raises really interesting questions, because you then have to think about the demographic that are in these aged care homes. And so because of the level of care that we're looking at, that hospital level and care home level care, the residents in this care are either cognitively or physically impaired to a point that they can no longer care for themselves. That's why they're there. And so there are a lot of, in essence, uncontrollable variables as to why that plate waste might be high. So it might be that there's a medication change, then they just physically aren't hungry. Appetite could be changed. Time that you're eating, stressors of being moved into an institution. There's so many different influences. And so when you're thinking about, well, what can we do to reduce that plate waste? It gets very complicated very quickly.
Yeah.
Yeah.
Well, because certainly an element of this as well would be that some, if not all, would be on quite tightly controlled diets, right?
Yes.
They would need to eat a certain number of calories and...
Yeah, so there is the whole space of regulation and policy. And so there's the regulation around making sure that the food provided is nutritious and, like you're saying, meets that sort of caloric profile. There's also restrictions and policy around portion sizes and what the minimum portion you could provide is. There's policy around, it doesn't matter if you've said no to that meal or not, you actually have to provide it. And those residents have the autonomy to say yes or no to that food. And all of the policy is very well-meaning to protect the health and well-being of this very vulnerable population. But the spillover effects often relate to higher rates of plate waste and food waste. And so, yeah, it's a really complex space to sort of navigate. And so what myself and the research team have been really clear about from the outset is that looking at the problem from the sphere of what is in organizational control and what is not, because it isn't really appropriate to be looking at behavior change for the residents. It's very unlikely to be effective, but also I don't think it's really appropriate for that population. And so taking an organizational approach, looking at what can we actually change within your organizational systems, the way you staff, the way you train, educate, the systems that you use, how can we create efficiencies, taking that lens.
This is all very interesting. Where then do you go from here?
Within the study? Or
within your PhD and the project.
Yeah, so I guess the project sort of has 3 distinct phases. So phase 1 was go into the facilities and use focus groups and interviews to understand what are barriers and facilitators when it comes to staff engagement in reducing food waste. And alongside that, we also did the food waste audits to get a baseline. The next stage was around taking the information and turning that into identifying where there's areas for interventions. And it was really important to me in the intervention design process that it was done alongside industry. I'm very aware that I am not an expert in aged care at all. And I think it would be really pretentious of me to go in and say, here's how we are going to fix all of your problems. And so I've been taking a participatory co-design approach and really working to involve those staff who want to be engaged, both at the facility level and the organization level, to be involved in this process of identifying potential behavior change interventions. And then also like feedback processes as we refine that toolkit down. And so we're in the midst of that right now and working to define that toolkit and those behavior change interventions. And there's a bit to be figured out in there. But anyways, the big unanswered questions at the minute.
Mm-hmm.
But then next year, what we will do is whatever that final intervention package looks like, we will be testing it across our 14 facilities and measuring effectiveness. So we'll be doing food waste audits at the beginning, the middle, and then post-intervention to see if there was if the behavior change went beyond the intervention period. But we're also looking at how else can we measure whether or not these discrete parts of the intervention were effective. So not saying this is going to be one of our interventions, but for example, if you're looking at educating to increase awareness of staff about food waste being an issue, looking at going, well, let's measure their awareness of food waste before the intervention and let's measure awareness after. And so was that piece of the intervention effective? And then also, did it have an impact on the actual amount of food waste? And so, yeah, that's all to be done.
But it's nice that you can measure these things, and it's got that quantifiable component. And
that's a real gap, at least with what has been written in the literature around food waste and aged care, is there's a lot of quantifying and saying this is the amount of waste, and even here's some potential ways that we could reduce the waste, but there's very little that's looking at, is this effective or not? And so then when you're thinking about applicability to industry, if there's no evidence to suggest that doing XYZ is going to help you reduce your food waste, is going to help you meet your environmental targets, is going to reduce your economic output, why on earth would they do it? And so being actually able to measure and to say, this has a positive effect by this much.
And it's something that's been designed for your way of doing things. And also
by you, for you and by you. Much more impact.
You said something in there too that, and again, I'm coming from a management background in LINS, but to go back later and see how much of it has carried on past your intervention, I feel like we don't do enough of that as management researchers. So it's very cool that you are going to be able to do that.
Yeah, I think that's part of that luxury of PhD, and just that it's in that that I have the time to be able to take that extra bit. Anything longitudinal becomes really challenging, eh?
Yeah, that's right. And you run into different challenges, like the organization I studied in my PhD. No one who worked there when I did that intervention still works there, and it's only been 3 years, so turnover is very high. And I'm almost certain, actually I can tell you for sure because I ran into someone who used to work there recently, and they told me that no one in that organization even knows that I did that study. So even just the fact that I did a whole PhD on your organization's practice, you don't even know that I did that.
I think that will be a factor for us for sure. Statistically, there's very high staff turnover within aged care institutions.
I assume that maybe there's some numbers anyway that maybe, and is there any kind of do they have training manuals and courses that people go through? Like when you establish this best practice, will it be put into?
That's a really great question. My understanding is that we're creating a resource that is available for aged care facilities who want to reduce food waste. And here is a resource that can enable you to go on that journey with some proven outcomes, so you are blindly going through it. And so I think it'll be very much up to the individual facility and organizations as to how they use that and how they extend it. But I have no idea what that's actually going to look like at this point in time. So
well, I was just about to ask you, so I'm glad you said that because I would be curious to know, and we'll definitely keep in touch and see what form this ends up taking, because there's so many things you could do with it. It could be an online module, it could be multimedia with video and audio and case studies, and could take many shapes. So we've spoken a little bit, because you are in early days, of course, about what the future looks like. What is on the horizon for you that you know of? Are you looking at maybe other conferences, or how are you going to put your publications together?
to be completely honest, my focus right now is very much on getting this intervention package sorted so that it can actually be tested next year. There's an enormous amount of work to be done in the next 3 months. It is a massive project, and the way that I am coping with that is by compartmentalizing. But I guess looking further ahead, I think in my third year, I would really like to do some more conferences. I would really like to keep in touch with industry, and actually be disseminating that knowledge. And then beyond PhD, not totally sure. So as I said, I'm based in Dunedin. In Dunedin, we have the University of Otago, and that's it. And Dunedin's home. All my family's there. I've got 2 little kids growing up there. So there's just lots of reasons to stay. And so if it eventuates that there happens to be a position in the management department that I happen to get, then I would think I could be very happy in academics. But I'm definitely not putting all my eggs in that basket.
Sure.
But anytime that I'm in industry or talking with industry professionals, I'm so enthused about how much space there is to make a difference. And I said earlier that my master's was in sustainable business, and I am really passionate about sort of that wider ecosystem of business, and how do we actually engage with businesses to be thinking about sustainability not as an add-on but as a core part of their business offering, and how do we help shift those organizational practices towards sustainable practices. I mean, there's so much work to be done in that space, in industry and in academics, and so something will happen. And it's 2.5 years away, so I don't need to think about it too hard right
That's
now.
right. Any plans you make, the world's going to look very different anyway. That's right. But I mean, that's if you're thinking, that's because the way that you're going about it to develop this framework or model or whatever shape it ends up taking, that's a skill set that a lot of academics don't have, to take something theoretical and transfer it into something practical, and then study the application of that. That'll be a rare feather in your cap.
Yeah, absolutely. And I think it's also taking a step back. The context of my PhD is aged care and food waste, but the learnings of how do we identify a problem and work as an organization to solve it could be anything, any context and any problem. And so that process of understanding how to collaborate and work together to affect change is kind of synonymous across any organization.
I often say about design thinking, which was the focus of my PhD, that once you have that big, beautiful hammer, everything starts to look like a nail, and you're making a new hammer. That's very exciting.
Yep.
Not everybody gets to build the hammer. That's very cool.
Yeah.
The last question that I ask everybody is, what is something not related to your PhD that you're excited about at the moment?
Yeah. So we bought a house 6 years ago now. And it's really quirky. It used to be an aged care facility. So it's this massive building, and we just have a little piece of it. But anyways, when we moved in, we're like, oh, all the things we want to do with this. But I've been studying the entire time and not making any money. So, but now with this beautiful scholarship, money coming in, we are going to knock out a whole bunch of walls to make a beautiful big living space that is open to the sunny side of the house. And I'm very excited.
Fun.
Yeah.
You get to use some actual hammers.
Yes. And sledgehammer into a wall. I'm really excited for that moment.
Yeah, when you get to the end of the PhD, you'll need that release. So it'll be good that you have that available.
Oh, forget about the end of the PhD. It's like end of the day.
That's right. thank you very much, Elena, for sitting down with me, making the time here at this conference. It's not easy to do for us to do that, so I appreciate you taking some time out to do it. All the best to you as you progress through the PhD and make all these changes.
Yeah, thank you so much. It was such a pleasure to be on here with you. So thanks for having me.